Whelan Presley Funeral Home and Crematory, a proud supporter of WQPT, has been serving Quad City families since 1889. They now have live stream capabilities for viewing your loved one's funeral or memorial service.
At IHM VCU, we've always been here for you. You are and always will be our top priority. We care about your financial and physical health, and we are here. IHM VCU is a proud supporter of WQPT.
A question of health. We look at COVID shots for children in a county where the adults are avoiding the jab, and an in-depth look at the health and well-being of everyone who lives in the cities. It's been 3 years since a comprehensive look at the health of the Quad Cities was last made. In 2018, there were real concerns about health disparities throughout the cities and bad habits we all need to break. Now with COVID, how healthy are we? We look at that in a moment, but first, kids and COVID. With the federal government approving COVID vaccinations for children as young as 5, what can we expect? We decided to talk with a public health official who's faced an uphill battle to get the adults in her county vaccinated, Henry County. We talked with the county's Health Department Executive Director, Angela Myers, from her office in Gladstone, Illinois. How difficult has it been to get adults vaccinated in Henderson County?
Our senior population, it has been good, but after that, from 50 to 18, they're very hesitant. They don't think it's here, I guess.
Yeah, and you know what? And I just noticed when I looked at your state statistics, I mean, everybody seemed to want to get a vaccine in March and April, and then it falls off significantly. Is that what you saw?
Yes, yes. At first most of the seniors were vaccinated right off the get-go. And we have been to the schools and got most of the teachers, but it's that 18 to 50-year-olds that don't feel the need for the vaccination. I think it's...
Yeah, go ahead. And you think it's why?
I think that it's going to just follow through with the kids because those are the parents of the kids that aren't being vaccinated. So I hope I'm wrong. And, you know, we're having vaccination clinics every Wednesday, and we get a few 18 years old and up, or 12 years for the Pfizer, because we have all 3 vaccinations. And so I'm hoping I'm wrong. I've had COVID myself. I went 1.5 years without getting it and testing everybody, and I had it in the last month, and I was fully vaccinated. But as we all know, when you are vaccinated, you have hopefully the symptoms or less severe symptoms.
Well, I'm glad you're feeling better. I mean, did you have less severe symptoms?
For 4 days, I didn't. I was pretty sick, but I'm of the older generation, and I think that sometimes, you know, we all know that at first who was in the hospital, it was the older people. And so, but I'm feeling better. I still have some residual, but I am better. So thank you.
What do you think is the issue as far as the low vaccination rate in Henderson County? Is it a case of it being a rural area and people are more spread out, so they feel that if they're not in close contact with other people, they don't really need it?
I think that's part of it. And at first, of course, people were abiding by the hand washing and social distance and what they were supposed to do. And right now, people have gotten lax. They're tired of it, and they want to get back to their normal life. But they don't want to social distance. I think that it's just going to take, I don't know what it's going to take. I really don't. I'm hoping that, you know, in the next few months, like I said, we have our clinics, and every week we have, you know, maybe 10 or 12. We just tick them off for the month's, time. And I think that eventually we'll, get more, but I don't think that we're going to get that many kids. I'm hoping I'm wrong.
Well, let's talk a little bit about the fact that you are doing public information. You're trying to educate the public as much. But you do know that there's this big pushback right now that they don't want to have the government telling them what to do. Is that kind of what you're running into right now?
Yes, it is. Yes, it is. They don't, there's that certain age, 18 to 50, that don't, none of us like to be told what to do. But I think that that's the biggest problem right there.
Now
I agree with you.
We're talking about the child vaccinations, which could be coming within days. So tell me, how important do you think that is? Because, I mean, you've talked to kids in schools. You have treated people 15 years and older already. How critically important do you think it is that vaccinations would reach down to kids that are 5 years and older?
Well, I think that to get rid of our masks, and that's what they want to do, I think that it's very important that the children do get vaccinated. And I think that that will help us to get back to normalcy fairly quickly.
The big argument, of course, is that the children don't necessarily get as sick as the adults do with COVID-19. But I do know that public health officials often point out the spread is so easy, that a child can pass it on to an older person or a person who has problems with their immune system. Is that the biggest lesson that you're trying to pass on to people when it comes to perhaps vaccinating children?
Yes, it is. Kids like to touch each other, and especially in a school setting. And if you have a child, comes to school with some mild symptoms and they're playing, even if they have their mask on, they pull them down and get them below the nose. And so, yes, I think that that's going to be the key.
You know that there's a lot of adults that were more than happy to get a COVID vaccine. They wanted to get this in their rearview mirror as quick as possible. And they're probably want to be the first ones to get their children vaccinated as well, especially because we're kind of on this timeline right now that if you vaccinate a child now, you get the second vaccination by Thanksgiving, and then you're fully immune perhaps by the middle of December. In other words, get a shot for the holidays.
That's right. Do it. Give yourself a present.
There you go. So do you think that you're going to be real busy in the very first few days?
I hope so. We plan to go to the schools especially when the kids' vaccinations are finalized, to have clinics out there. I'm not real sure how many of the teachers. We vaccinated close to 100 teachers at our West Central. And just a handful of those have had the booster. So I'm not real sure how many of those are going to have the booster, but we plan to have clinics. We plan to go to basketball games once or twice to open up a clinic for that. So we're trying every angle that we can.
You have heard of the term twin-demic, which is being passed around right now, where you have both the COVID pandemic and fears of a tougher flu season. There is a fear among health professionals that since the flu wasn't that big last year, that we have no idea what's going to be the toughest strain this year, and thereby the flu season could be much worse.
Yes. And we all know that, they both mimic each other. You can have the same symptoms with either flu or the COVID, other than the taste and smell. That seems to be, one of the separate ones. So
do you also see in Henderson County much of a pushback against the flu vaccine as well?
We just started our flu vaccines clinics, and it hasn't been real big, but here in Henderson County, we have trouble getting the word out, and because we have no TV station, other than the local TV stations or radio, and it's just hard to get information out there when you're going to have your clinics. But we try as hard as we can, hanging up flyers and things like that. So I'm hoping our clinics for the flu will pick up.
Because I know we visited you last year, in fact, when you were just doing the testing, and that was a monumental task for your health department to get that done, and you needed enough testing kits, and that was a problem as well. I mean, do you have a problem getting to all the parts of the county as far as the vaccine is concerned, and do you have plenty of supplies?
We do have plenty of supplies, and of course, in Henderson, at the health department, we don't have many staff, so it takes us all. And we still are doing the testing as well as the vaccine. And we are going to go to 4 of the major towns to to give a flu clinic, and we will take the COVID vaccinations with us too. So hopefully maybe we can pick up a few more like with that.
Yeah, that's kind of an interesting thing, is that if you're offering the flu shot, which somebody might be less hesitant to get, to also have the COVID shot. And you've been saying, and the health departments all around the country have been saying, getting both shots at the same time is just fine.
Yes, we've done that, and I have not had any reports of any problems. So,
Henderson County Health Department Executive Director Angela Myers. In a moment, how healthy are we in the cities? But first, Laura Adams is all set for November activities you should put on your calendar if you go out and about.
This is Out and About for November 5th through 11th. The annual Fall Antique Spectacular Vintage Market is back November 5th through 7th at the QCCA Expo Center, while the Spotlight Event Center hosts Winter Wonderland Craft and Vendor Fair the 7th from 11 to 4. While the fall premiere Gone Farmin' auction offers an unparalleled array of vintage and collectible tractors November 11th through 13th at the Bend Expo in East Moline. Visit the Figge Art Museum for a Veterans Day presentation of the Mid-America Emmy-nominated documentary Stout-Hearted, George Stout and the Guardians of Art. A Q&A with the director follows the film. There's entertainment on tap with Tomfoolery on Tremont at the Renwick Mansion featuring comedian Brad Wenzel on the 7th. The Dead Rabbits featuring Craig Mabbitt of Escape the Fate performed the 9th at the Village Theater. And the Quad City Symphony Orchestra presents their Masterworks 2, Fantasies and Fables at the Adler Theater, while Allison Miller's Boom Tick Boom performs at the Orpheum Theater in Galesburg the 5th at 7. Mercy Me presents a concert with special guest Micah Tyler at the TaxSlayer Center on the 11th, and Songs and Stories with David G. Smith, Alicia McKillie, and Shannon Labrie takes place at the Redstone Room the 5th at 8 p.m. On stage, Shakespeare's powerful classic Macbeth will be performed at the Bruner Theater on the campus of Augustana the 11th through the 13th. For more information, visit WQPT.org.
Thank you, Laura. Throughout the pandemic, many of us were staying home getting a little claustrophobic. Well, that's the title of the song, written by our featured musician. Here's Murray Lee from the Black Box Theater with Claustrophobic.
I was flipping through a news article about our brains. Their size and their shape are genetic. Oh, what an awful trick. I was reading chapters in a people's history of the United States. Oh, what an awful place to be, and I'm too poor to leave. I was reading in a science journal about Mother Earth. Her fever's getting worse. Oh, I'm stuck in a hearse. I was trying to understand a Brian Greene book about space-time and how our strings are attached to it. Oh, we can't leave this universe. skipping through a news article about our brains. Their size and their shape are genetic. Oh, I feel so claustrophobic.
Murray Lee and Claustrophobic, recorded at Moline's Black Box Theater. The healthcare community in the cities comes together to find solutions to find the most pressing issues that are facing our health and well-being. The Quad City Health Initiative spearheaded the latest community health assessment, looking at the needs in the cities, the successes, and the areas where our health is falling behind. We talked with Quad City Health Initiative Executive Director Nicole Karkner. So Nicole, why is the community assessment even needed?
You know, that's a great question, Jim. I'm happy to share with you a couple thoughts on that. You know, the first is that the Quad City Health Initiative's mission is to create a healthy community. So in order to do that, it's really helpful for us to understand what the current health status is of our community and also what the health needs are of our community. We can do a better job in meeting our mission if we have that information available to us.
You can't fix the problem if you don't know what the problem is basically what you're saying.
Exactly.
Well, let's be honest, the biggest problem right now is COVID.
Well, true. We certainly heard and saw that in the assessment this year, and we were expecting that would be a big topic when we asked community members to tell us a little bit about what they thought was important. Certainly they mentioned COVID, and we heard that through the survey we conducted as well as through focus groups we held. But I will say, too, that, a number of the issues that folks mentioned this time in this 2021 study were also mentioned in prior studies. So there are still other health issues that are very important to the community.
Well, absolutely. And sometimes, to be honest, I mean, you talk to public health workers, is that sometimes these other issues are put in the background because COVID's so much, monopolizing the healthcare system right now. But let's talk about one thing in particular. These health assessments that you've been doing are nothing new. It's almost 20 years of it. So I'm sure you're starting to see trends, and I want to talk about that. But one trend that really caught my eye is that the number of people saying their health is only fair or poor is actually up.
Yeah, that's true. So now it is the case that most residents do say that their health is excellent, very good, or good, right? So most people have a positive view of their health. But we do look specifically and we do track those that say that their health is fair or poor. And we have seen that number increase over time. So, of course, that's of concern because we want to make sure that we are paying attention to those types of responses and aware that, while maybe the majority feel like their health is good, there's still a very large portion of the respondents who are saying, hey, actually, I'm not sure my health is that good. And so we really do want to pay attention to those trends too. And we did see that. I think it was about 24.8% of total area adults this time said that their health was fair or poor.
Yeah, but that's 1 in 4. And that is a pretty big number that would have some concern. And also it kind of underlines that other thing, because we always talk about wage disparity, but there seems to be health disparity as well. There's the haves and the have-nots.
Yes, that's true. So, one of the other things that we've seen over time in conducting this assessment is that a lot of the conditions of our health are influenced by other conditions in our community, right? We talk about these things as the social determinants of health. So it includes things like income and education and where we live, the physical environment in which we live. All of those things influence our health. That's one of the reasons why we take a cross-sector view of health improvement, because we know that all sectors of our community have a role in creating health for us as individuals and also health of our community overall. So, as we look at these trends and we think about those impacts, we are very aware that, for sections of our community that may be experiencing challenges with employment or income, that can over time have an impact on people's health. And so it's important for us to be thinking about all of the ways, all of the things in our community that influence our health.
I know that also 3 years ago, last time I bothered you and asked you about the last assessment, We talked a lot about two different areas. One was mental health and services that are offered to the public. The second was healthcare for women, and that there was so much need in that area. Well, let's start with women's health. Are there still major concerns that women are getting the treatments that they need? Has it improved at all in the last 3 years?
Yeah, so, we are able to look at a lot of indicators in our survey report and see how health status differs for different genders as well as different age groups. And we have other demographic characteristics that we're able to look at. So that helps us to understand where there may be differences that people are experiencing. One of the things that we also look at is infant health and family planning. That's a category of the assessment. And that was identified again in this 2021 cycle as an area of opportunity. We did see that there were some women who were saying that they were having challenges obtaining pre or postnatal care. We also did see that there were indicators related to teen births that we want to look more at. So certainly thinking about the health of women, the health of children is critical, and planning for the future health of our community. And we'll be looking at that issue again a little bit more this year.
And I think there's a brighter light being shown on mental health care these days, that it's not something to be forgotten or dismissed. It is a major part of health care in the cities.
Yeah, I'm so glad you say that, Jim, because, one of the things that we have been trying to do through our work is encourage community conversations about mental health, make it easier for people to feel that they can talk about mental health as part of their overall health. We did see again in the 2021 study that there were several indicators related to our community's mental health that are, again, areas of opportunity for us. And so we really want to be continuing to encourage that dialogue, encourage that conversation. If folks are experiencing symptoms of depression or even symptoms of stress, which, we know over the last year and a half, everyone has been feeling stress.
Yeah.
It's important to feel that folks can talk about that, share that information, and hopefully be able to find treatment if needed.
Well, of course, we always want to know, you did the study, now what? I mean, how do you progress from that? But let me ask you that question in a different way, is that you did the study in 2018, what was accomplished since then, and what can you build upon now?
Sure. No, that's a really important question. So this assessment is a collaborative effort of 7 organizations: our health systems, our health departments, our community healthcare federally qualified health center, the Quad City Health Initiative. And so what we do is we use this information to inform our plans as organizations and as partners. After the 2018 assessment was completed, we actually wrote health improvement plans that identified, actually it was nutrition, physical activity and weight, mental health, and access to health care as 3 priority health issues. And so since that time, all of the partners that are party to the health assessment process have been working through their organizations and in coalitions in the community on various health improvement tactics. So for the Quad City Health Initiative, for example, for the nutrition physical activity category, we've been working for a number of years with a community coalition called Be Healthy QC. And we've been continuing over the last couple of years to share information about nutrition and physical activity resources that are available to community members, to hopefully highlight and spotlight some of the programs that are available that people can participate in, to encourage people to do things like go outside for a walk on a trail. We have a wonderful resource we developed a few years ago called qctrails.org. And over the last couple of years, we've been continuing to grow that resource and also encourage people to access that information, find out where they can go for a walk and perhaps have a new view of the Quad Cities that they haven't seen before, and also get some physical activity into their day. So this health assessment really is foundational to the planning work that we do, and it helps to inform then the types of projects that we're able to create together.
I think you do point out something interesting, because you say, people can make access of these walking trails. They can get exercise. They can go see a doctor or a dentist or a mental health clinician. It sounds like it's really the onus is on all of us as individuals, but I think in so many ways you want to point out, especially since you have such a broad band of suppliers and participants in this assessment, that there is help out there for people who need to make healthy choices or to get a check on their health.
Yes, absolutely. You know, one of the things that we did hear as we talked with community members in this assessment process is that folks are looking for information. They are, eager to know what sources of information or education are available, and sometimes just need some assistance to, figure out where to connect with that information. So we certainly are eager to try to make that information more available to the community. Again, through the Be Healthy QC Coalition as one example, the group has assembled a resource guide that we have available on our Quad City Health Initiative website as just a starting place where people can go to get information about programs and activities related to nutrition, physical activity. So with those sorts of efforts where we're trying to highlight or showcase what's available or, consolidate information to make it more accessible to community, we hope are really important and valuable to the community at large.
Quad City Health Initiative Executive Director Nicole Karkner. On the air, on the radio, on the web, on your mobile device, and streaming on your computer. Thanks for taking some time to join us as we talk about the issues of the cities.
Whelan Presley Funeral Home and Crematory, a proud supporter of WQPT, has been serving Quad City families since 1889. They now have live stream capabilities for viewing your loved one's funeral or memorial service.
At IHM VCU, we've always been here for you. You are and always will be our top priority. We care about your financial and physical health, and we are here. IHM VCU is a proud supporter of WQPT.